Daremos inicio al pilar bienestar laboral descubriendo modelos y prácticas transformadoras con una increíble invitada, Evangelia Demerouti. Es profesora titular de Psicología del Trabajo y las Organizaciones en la Universidad Tecnológica de Eindhoven. Con una destacada trayectoria en investigación, ha publicado más de 250 artículos sobre rendimiento laboral, bienestar ocupacional y equilibrio entre la vida personal y laboral. Estuvo entre los 50 investigadores de mayor impacto a nivel mundial en Management and Business. Además, es presidenta de la Asociación Europea de Psicología del Trabajo y editora asociada del Journal of Occupational Health Psychology. Demos la bienvenida a Evangelia.
Hello everyone, my name is Evangelia Demerouti. I'm Professor of Work and Organizational Psychology at Eindhoven University of Technology in the Netherlands. I'd like to thank the organizers of the conference for inviting me to talk about burnout, which is one of my favorite topics that I have been researching since 30 years ago. I will start with clarifying a little bit what is burnout and how it can be diagnosed. So burnout has been around since 1974, but only recently it was recognized as an occupational phenomenon by the World Health Organization. The WHO defined burnout according to Maslach's and colleague definition, which defines burnout as a prolonged reaction to chronic, emotional and interpersonal stressors in the workplace, characterized by three dimensions, namely exhaustion, cynicism, and inefficacy. Since 1974, there have been several definitions on burnout. Recently, there was a review that counted 13 different definitions of burnout, so you can imagine how complicated it is to define it. But what all these different definitions have in common are two core dimensions, namely the feeling of exhaustion and or erosion of energy and a distal or cynical attitude towards work or the customers and the products of the work. All these definitions that have resulted actually to measurement instruments have the disadvantage that they are not developed to be used as diagnostic instruments. So we actually lack a valid diagnostic measurement of burnout, mainly also due to the lack of clinical validated scores. We don't know how much exhaustion some person needs to be considered as at risk to burnout. Another problematic issue is also that several of the symptoms of burnout overlap with other health outcomes like depression, anxiety, and fatigue disorder. But keep in mind that the core aspects of burnout are high and frequent feelings of exhaustion and a cynical or distal attitude towards work. Although we lack a definition on burnout, many people suffer from it. And there are some countries that even give some benefits, some compensation for absence and sickness due to burnout, in Europe at least. So we have the situation that many people suffer from it, but we still need to clarify what it is. Therefore, there have been several studies, thousands of scientific and other papers have been published on burnout. Several of them have focused also on the predictions, the causes of burnout, and the most often used theory that explains the causes of burnout is the job demands resources theory, which describes the work environment on the basis of using two broad categories of work characteristics. On the one hand, we have aspects that require our effort and therefore are associated with psychosocial, psychobiological costs, including fatigue, These are called job demands, and examples of them can be physical demands, demanding customers, working times, and workload. On the other hand, there are also, fortunately, always aspects in the job that help us to deal with these demands, help us to minimize the impact of the demands, and also to develop ourselves. These are called job resources. An example of them can be a coaching supervisor, freedom of decision on how to organize your job, and social support. And as you notice, these two have to be in balance. Moreover, job demands and job resources are initiators of two different processes, both leading to the experience of burnout. Namely, the job demands are responsible for a health impairment process. The higher the job demands, the more the energy is used, and the more the possibility is that the individual develops feelings of exhaustion. On the other hand, the higher the job resources, the more motivated the person is, and the less possible to get distant or cynical towards his or her job. So these health impairment and motivational processes are responsible for the experience of burnout at work. And when is that the case? As you will see here, combining high job demands with low job resources is the worst case scenario, and the combination where people have more risk to experience burnout. Whereas when demands are high and resources are also high, then people have the more chance to get engaged in their job and to be more enthusiastic. During COVID, we found out that it is not only the job demands and the resources that are responsible for the health and motivational process, or the health impairment and motivational process, but also aspects of the job or of the organization. So outside our own job and job tasks are also responsible for using our energy and leading us to feeling exhausted or demotivating and making us feeling distant from our job. So the demands and the resources from the various domains need to be in balance. So if there is something that I want you to remember after this presentation is the following. Employees will remain healthy and avoid experiencing burnout when their demands are affordable, when they can manage them, and when their resources are sufficiently high. Moreover, they remain healthy and avoid burnout when they use strategies that help them to recognize and regulate the external demands and resources. So you need to keep the balance between the demands and the resources in yourself and in your environment to avoid that you experience burnout. This is actually the key, and I will present you a little bit some evidence to justify why I claim this why I give you this take-home message based on evidence. So we have done, or there have been several studies that indeed justify this conclusion that demands lead to exhaustion, and that exhaustion is the predictor of several outcomes, including task performance, as ratings from a supervisor, or absence duration, as registered by the organizational records, whereas job resources are related to higher engagement or lower distance and cynical attitude towards the job. And this is then related to lower absence frequency, better citizenship behavior, more financial turnover, more creativity, and the positive reactions to customers. So several outcomes that are not only experienced by the individual but also perceived by others. And this is very important because we need to be sure that burnout does not exist only in the minds of people, but it is also present, and that the consequences of burnout are visible to others. In the first study, where we introduced actually the job demands resources theory that I just presented you at the beginning, we used not only self-reports from employees that reported or rated the level of demands and resources as well as their level of burnout, so the self-reports, but also observer ratings of the demands and the resources prevailing in this specific job. And what we see is that we found exactly the same relationship, irrespectively of who the rater of the demands and the resources was. So the causes of burnout seem to exist irrespectively of the individual's perception. In this study, we also used integrated different sources of information. So we asked the employee who was providing services how cynical was towards his or her job on that specific day, and how much social support this person received by people from the organization. And then we had observer raters that observed how often this employee was on 1 hour, 1.5 hour interrupted by different people. So the number of interruptions as observed by observers. And we also observed at the same time how negatively the employee reacted to customers. So two different evaluations did the observers, and at the same time we also asked randomly customers to evaluate customer satisfaction as provided actually by us for the service that the employee provided on that hour that we observed. And what we saw was that indeed the higher the amount of interruptions and the lower the social support on that specific day, the more cynical the employee was, and then the more inclined was to react negatively towards the customers as observed by the observers, and the most possible it was that the customers rate the service that they received from this employee negatively. So you see, with different sources of information, we see how detrimental the experience of cynicism is for the employee and those who are served by this employee. In this study, we also used again an objective outcomes. There were pilots, British pilots, who normally do every 6 months simulation training so that they can see how good they are still in their job. And we looked at whether job demands and job resources influence burnout of these pilots, and whether that burnout influenced their performance during the simulation training and happiness, and whether the use of proactive strategies like job crafting can explain why burnout makes the pilots less well performing and less happy in their job. What we saw was indeed that job demands lead to more exhaustion, but job exhaustion was not related to performance at the simulation, but what was related indirectly through making these pilots less inclined to look for extra challenges in their job, and that made them less well performing. At the same time, job resources, like relationship with organization and social support, were negatively related to disengagement, which explained actually happiness, but also the performance during the simulation training by making people less inclined to craft their job, namely by making them less inclined to optimize their demands, which is something that the airlines were very surprised to see, that even pilots need to optimize their demands so that they make them affordable in order to perform better. Burnout is responsible for long-term sickness absence, and in this longitudinal study in Sweden, we saw that people who experience high exhaustion have 4.8 times more risk to be absent long-term, so 90 days or longer, due to a mental diagnosis or due to and 1.6 times due to a musculoskeletal diagnosis. And these risks are higher for the burnout exhaustion component than, for instance, for depression and self-rated health. So exhaustion of burnout is really a very good predictor of long-term sickness absence among employees, even better than depression and health. In this study, we looked actually, we measured people 4 times in a year for 1 year. And what we saw was that people first seem to develop symptoms of disengagement or a distant attitude towards the job. And then over time, they seem to develop disturbances in sleep quality, which is another possible predictor of the feelings of exhaustion next to what happens at the job, next to the job demands. So there is some kind of sequence of the symptoms. People start to feel disengaged, have sleepless nights, bad quality of sleep, which contributes further to increasing their feelings of exhaustion. What we also see is that people can do something to diminish the impact of exhaustion on behaviors. And here we looked at task performance as rated by supervisors and adaptivity to changes. What we see is that when people experience high disengagement or high exhaustion, they seem to be their performance or adaptivity seems to be less affected by these feelings when they use high compensation strategies. So when they try to compensate for the lack of resources due to burnout, to find alternative ways to achieve their goals or to arrange some help to achieve their goals. So people can do something themselves to diminish the impact of burnout on their behaviors. But still, what we see and what is often the case, the experience of burnout is actually a synergy the result of a synergy of events. For instance, here in this study, they showed that the impact of demands on exhaustion and cynicism, the two main aspects of burnout, is stronger. So there is a steeper line, the solid line, for those who have high negative life events, who experience high negative life events next to the high demands. So there is a kind of interaction effect, so the effect is even stronger, or the effect of job demands on burnout when people have some negative life events like the loss of someone in the private life. That makes things even worse. But as you see, the cause is actually the work-related aspects, the demands in this case. Okay, now what can we do after having known this? In a literature review that we did recently, we found that most of the interventions are on the personal level, like mindfulness interventions, stress management interventions, or cognitive behavioral therapy. But evidence shows that the effects of the interventions on burnout are short-term, so they don't live for a longer time, and they are mainly on exhaustion, not on the other aspects of burnout. There are also organization-directed interventions, like to provide more autonomy, participative approaches, job design or job redesign, improving work processes, taking out bureaucracy, that kind of things, better communication, collaboration among teams, individuals. They seem to be efficient, particularly for the cynicism or the third component of burnout, inefficacy. Of course, the literature suggests that a combination of person-directed and organization-directed interventions is more effective to combat burnout symptoms. I myself did an online training intervention in which during COVID actually, in which I trained people to recognize their feelings of stress and their own emotional state, so self-recognition, to learn how they can improve their demands and resources themselves on a daily basis, to learn how to recover and restore their energy, to manage work and life by managing the boundaries between these two, by using a tool that people followed without having to come to a specific place, but an online training. An example, for instance, of the exercise on how to recognize your experience, your feelings, is that you look at yourself in the mirror and that you say, how you feel, what you see there. Or an example of work-life management is that you help people to think of a ritual in which they specify what is their working time and when does the free time start. And for recovery is to understand what activity has the most restoring effect for your energy. So I had the possibility to hire trainers and actors to taught this information, to train this information with the participants and to come up with some nice tools to keep the participants engaged in the training. And what I found was that the training was indeed effective to improve several outcomes, including emotional intelligence, relaxation, and work-family conflict, which were predictive of reducing actually fatigue, the level of fatigue and motivation as the two important aspects of burnout. So it helped people to recognize how they feel, or helping people to recognize how they feel, how to relax and how to manage their role boundaries, help them actually to reduce their level of burnout on that specific moment when everything was during the pandemic very stressful for everyone. So by coming to the conclusion, what are the implications of this? My conclusion is that burnout is the erosion of energy and motivation. That is how we have to see it. High demands and low resources in the job or other life domains are related to an increase in the risk to burnout. Employees can use strategies to reduce the risk of burnout and the detrimental effects of burnout. So people can do something, but still my suggestion is to combine interventions both on an individual and the organizational level in order to be more effective in reducing burnout, the risk to burnout. With that, I'd like to thank you. I wish you a nice conference and hopefully I will see you soon live in Chile. Bye bye.